I will power on with a bit about our strategy. This is what we're focusing on this year, where we're looking to build on what we've done over the last 4 years and produce a better result and better outcomes for service users in Croydon. The core activity that we engage in, which Gordon's talked about and Jay will go on and talk about, is gathering the views of service users in Croydon. So that's what we exist for. We don't have an agenda as a board of our own. We exist to gather the views of service users and make them known to service providers and to elicit change in relation to them. That's what we're here for. We've got a huge quantity of data, 15,000 pieces of data on our database now. Gordon said we do a lot of outreach. We do over 70 outreach activities. We've got a load of information. What we're looking to do this year is to gather a greater depth of information on specific issues, so that we can make our recommendations stick when we take them to the CCG, or we take them to Croydon University Hospital, or we take them to GPs. We want a body of evidence that's strong enough to actually enable us to get a result. The second thing we want to do is we want to gather information in a more timely fashion, so that when an issue arises, we've got a means of gathering information quickly, and we've developed a snapshot process where we gather 50 views on a particular issue very quickly, and that's what we want to use to become more influential and actually make a difference, not just gather views which we pass on and people say, well, that's really interesting, but where something actually happens as a result. Part of that is to work more collaboratively with stakeholders, and I use collaboratively in a constructive and positive way rather than being in league with people to prevent things happening, particularly with organisations like Richard's or other specialist charity organisations, where we've got common issues. Then we'd be looking to work collaboratively with them, because we're going to be much more effective if we've got better evidence and we've got better support for the views we're expressing. And there's also the possibility to work with the CCG and other providers where there are issues of common concern. Then there's potential for us to investigate them and be more influential as a result of having gathered the information. That's what we're looking to do. Regarding the caring services, of course, Enter and View is one of the principal tools that we have at our disposal. It is a resource-hungry and expensive process. It's something we're looking to get better value out of doing. So what we've done is we've been doing some work with Camden Healthwatch. We've developed a more structured approach. We've looked at that, we've adapted it to our need, we've tried it out in a couple of places, and that's what we're going to be using in future. But I'm very keen that we seek other ways of getting feedback on care homes in Croydon, because it's actually, when we do our visits, there are a number of limitations, not least, in quite a few cases, it's quite difficult to get views from service users, either because of their particular condition, or perhaps they're sometimes reluctant to express their views. So I think there's potential in friends and family trying to get feedback in that way, and that requires us to develop a slightly different approach, which is one of the things we're going to be looking at. The next three are really more organisational. The three I've talked about so far are more operational. We want to raise our profile. A couple of years ago, when I first got involved in Healthwatch, we had a real problem in the fact that nobody had heard of us. And I think we're now in a situation where we are much better known, but we still, if you take the 400,000 Croydon residents, I think it's reasonable to assume that a large proportion will not know us. So we are looking to raise our profile. We're looking to use our outreach activities so that we raise our profile. That's why we're at Purley Hospital. That's why we're at Croydon University Hospital. Also, the website developments are key to that. We're looking to produce a monthly update on what's going on in Croydon. I think we'll get more hits on our website that way, and that is a key route in to becoming better known. Refreshing the board. We've existed for just over 4 years now in Croydon. We have 7 board members at the moment. Two are planning to retire from the board in the coming year. We've got a great opportunity to refresh the board. As you're probably aware, the board's role is not operational, it's strategic. Doesn't mean we don't get involved operationally, but our role is to steer and make sure that Healthwatch is delivering against its stated objectives as a charity. We will be looking for people who feel they've got a contribution to make in that context to join the board. We will be advertising, but if anyone here is interested, then it would probably be good if you have a chat with either Jay or myself afterwards. Particularly looking for people who are Croydon-based or got strong links to Croydon, and we're looking for people who've got something in their background that enables them to make a contribution. There's no specific requirement. You've got to have a business background, but you need to have people who can help us steer what Croydon Healthwatch does. And finally, and most importantly, there's the volunteer experience. We're very lucky to have around 70 volunteers, very committed. We want to enhance that experience, and we want to achieve more with it. I think we're particularly looking to develop the roles that volunteers can play in our organisation, whether it's ambassadors or helping us pursue specific issues. Potentially, we would part of that might be to provide some suitable training for volunteers to be able to operate. And above all, we want to create put a bit more focus on having a community of volunteers. I know Gordon's developing a volunteer newsletter, and I think we want to try and create more of a community feel, a more integrated approach. Because I know that from time to time volunteers have felt a bit isolated. I know I did when I was a volunteer. I would come along and do something and then go away again. So we want to try and create that community. So really, this splits into 3 parts. We've got some operational objectives to become more effective with all the information we collect. We want to raise our profiles so that more people know about us, more people give us their views, and we want to strengthen our organisation in terms of the board and our volunteers.